Welcome, everybody. I am Dr. Dream, and you are here at the It's All Good show. My guest today is going to speak to us and take us into a world that I know a little bit about, but not so much. And so I find all of the information that he'll be sharing with us really fascinating and helpful and therapeutic. And the way that I found him was through my brother David, who was going through some kind of crazy things in his life, and things were coming up, and he had tried all sorts of different therapies and treatments. And then in Prescott Valley, where he lives, he found the Revitalize Ketamine Clinic. And he went through a process, and Casey's going to kind of bring us into that a little bit and everything. So I'm just going to jump right in. My guest today is Casey Dubravcic, and he is with the, are you the founder? Or are you the owner?
Yep,
What are we, founder of the
all the
Revitalize
above.
Ketamine Clinic, which is located in Flagstaff, Sedona, and Prescott Valley. So he's got that most beautiful part of the state of Arizona covered. Welcome to the It's All Good show.
Thank you so much. I really appreciate you. Thanks for having me. It's a pleasure to be able to share kind of what we're all about. I've been in healthcare since like 2004, and I worked in very much traditional Western healthcare, like ICU, CVICU, pre and post-operative areas, and the pre-op and PACU areas, as well as the inpatient, outpatient behavioral health units at the local hospital, Flagstaff Center. I'm trained in electroconvulsive therapy. Also worked the inpatient, outpatient units at the Guidance Center, which is the community mental health center up here in Flagstaff. I was their only child provider for a couple of years. And I got pretty jaded on the traditional Western medicine treatments. You think of mood super basically as that waveform, right? Like that depression, kind of anhedonia, the I don't cares down at the bottom. And then that anxiety, hypervigilance, that kind of like pucker state, that fight, flight, or freeze state up top. And people with trauma kind of bounce back and forth a lot quicker between those two. In traditional psychiatry, pretty much every medication that I ever prescribed, SSRIs, like Lexapro or fluoxetine or Prozac or Zoloft, SNRIs like venlafaxine or desvenlafaxine, mood stabilizers, antipsychotics, benzodiazepines, hypnotics, all like 10 to 30% effective long term, and just kind of squishing that waveform. So very much symptom based on treatments, and pretty much, they all kind of stop working or reduce working over time. And my opinion, and a growing number of psychiatric providers, is that those symptoms are really your psyche's cries for help. Hey, what we're doing isn't working. This stinks. This sucks. And so I kind of do a disservice as a psychiatric provider if we're taking the magnifying glass away without really treating that core issue. And so, really, what we're doing now, and lights up my life. Like I love what I'm doing now. It's so incredibly rewarding. I get to help people help themselves. And that's really what we're all about. Is like we're providing a safe place, that setting and sustainability. So much of that Western medical model is very much that potentiated illness model. So the pharmaceutical industry, insurance industry, and honestly, most providers and agencies, because the way the system is set up, are incentivized to keep people ill, keep them on daily medications, kind of keep them coming back forever, kind of circling the drain, if you will. And then, we're working off of this wellness model where for most people, we're going to do a series of 6 treatments over a period of 3 weeks in combination. And is really important. I want to emphasize with integration, what happens after the ketamine treatment. So, again, we're proud of ourselves on that set, like how we go in. So I have a whole integration workbook that I go over with people before we get started. That setting. So I think it really is important to be in a safe place, as kind of all of these ego dissolution agents come kind of to the forefront. And then that sustainability, like I would love it if I were out of a job. Like if everyone was in a really good headspace, like I would, that would light me up. The sad part is there's so many people suffering right now. It just stinks. And so the way we set up treatment gives people like 80 plus days, really good neuroplasticity, that ability to quite literally change their mind. Within 2 or 3 minutes of starting a ketamine infusion, we see new dendrites forming on a functional MRI, which is that ability for your mind to really create those new pathways. And I talk about this all the time. And like I have my own podcast, Mental Wealth Moves, because the best investment you can ever make is in yourself. That being said, like, I'm here for you. Like, what kind of questions can I answer?
Well, I have to say that David is my older brother, and I've always thought of him as, just being really rock solid. I understand that all of us go through things in life, and we get to places where we're we allow things to come up that then need to be worked on. And so I watched him, and he shared very openly with me the different processes that he was trying. And it was fascinating to me to hear what he was doing and then not getting the results that he wanted. And then he found you guys, and we saw him for his birthday just recently, in the last week and a half, and the shift. The shift that he had experienced, and you just look at him, like the clarity of his being, of his energetic field and everything was amazing. And I said, I've got to, check with Casey and see if he would like to be on the It's All Good show, because this is really remarkable. And so you probably get people that are dealing with challenges sort of across the board, from one spectrum to the other, of being almost incapacitated with what's shown up in their lives, and then others, like I would characterize David as like being, in my mind, being like incredibly functional, but having this nagging energetic going on that was just getting in the way. Um, who is this for? Like, the who is it for? And then on the other side of that coin, I guess, is who is this not for? Because I've got another friend that has gone through this, out of Southern California, and he integration. He'd have a session, and then he'd have a session with a therapist within like a day of his each treatment, and he had a round of 6 treatments. And he's a very close friend of mine, and he would follow up with me after each one of the sessions and say, here's what it was like, here's what was coming up, and everything like that. And David shared a lot with me, but I get the feeling that it's not really for everybody. It's such an intensive thing. And I've been immersed at different times in my life in the psychedelic world. And so some of the stories I hear about this, I'm like, wow, that reminds me of a trip I had, blah, blah, blah. And so I feel like that terrain I would be pretty open to it. I'm not sure everyone would be. Now I'm going to let you answer.
Yeah, great questions. So anytime we're using intravenous ketamine, IV ketamine, which is what I'm the most passionate about, and there's a multitude of reasons that I would put IV ketamine ahead of everything else. One, it's the best bioavailability. It goes straight into the vein, IV access, so 95, 99% bioavailability. Two, it's the safest. Honestly, it's on the World Health Organization's list of essential medications as an anesthetic. And so, like, pretty much every pre-hospital provider, every paramedic, every firefighter, that is a medic, every emergency department has ketamine on site. And they can give like orders of magnitude higher dosing than what we give in our clinic to start off with. And then, really it's about safety. So you touched on, the kind of psychedelic world, and ketamine falls in there. And this is kind of what I'm saying. It should be looked at before all of what I call ego dissolution agents. And so I define the ego as what's kind of trying to protect us, right? It's born out of necessity, born out of purpose. For some people, that part of that ego that was very adaptive at some point in your life becomes maladaptive as your environment changes. And so, like having a hypervigilance or like a kind of a more of a pucker state at night, at one point was a really helpful thing. And then when you're in a safe environment, a lot less helpful. And so you think of those like sled tracks, right? Go down a sled track a couple times, gets pretty hard lined. Go down a million times, it's like a toboggan trail, almost impossible to get off of. When you do our series, it's like 5 feet of fresh fallen snow. So really that ability to quite literally again change your mind. Very much energy in, energy out, like you talked about, so much less important what actually happens during the ketamine treatment and much more important what you do afterwards. So again, I'll just finish those 5 reasons. One, best bioavailability. Two, best safety profile. It doesn't decrease your respiratory drive like a lot of other anesthetics. It doesn't have a risk of serotonin syndrome like ayahuasca or psilocybin will or any other serotonin modulating kind of ego dissolution agent. So people who are taking, a daily antidepressant or even taking high doses of ibuprofen, they die every year, going to kind of a ceremony or macro dosing, high dosing psilocybin or ayahuasca without having that kind of vetting process up front. Um, and first off, when you're going to a clinic, you're getting a heavy medical vetting. And secondly, there's just no risk of serotonin syndrome with ketamine because chemically it's very different. Three, it's the best efficacy profile that we know of out of all the ego dissolution agents because it's the most well studied. I'm not saying it's the best one. I just know that right now it has the most evidence to support. Like again, those traditional medications, like 10 to 30% effective, just kind of making you less everything. A lot of people complain of being zombified, that sort of thing. And then the ketamine 70 to 95% effective and helping people treat the problems causing the symptoms. So really exciting there. Fourth, it's the only version that's legal. So I think that's super important. Just because, like you're able to go to a clinic, you're able to have medical oversight, you're able to be in what is a safe place. We're under regulations and that sort of thing. There's a lot of people that are subjected, particularly like traumatized women, to a secondary kind of victimization that takes place by, again, a shamanism kind of person, unfortunately. And then like the last version that I talk about, it's the only version you can pause, which I think is really like important when it comes to if you're going to a dark place, because really, in my opinion, everything falls from trauma. Everything's a coping strategy for trauma, and trauma is very subjective, right? And so if you're going to this deep, dark place, having an exit strategy is so important. It keeps people in the driver's wheel, right? And so letting people know that they're safe, letting them know that they're in a safe environment. We're watching their vital signs the entire time. And if they're not ready, they press the pause button. 2 to 5 minutes, they're back. We do like a 45-minute infusion for most people for mental health. We do a 90-minute infusion to what we call pain infusion. And that can be for physical pain or mental pain. Double the dosing, double the time. We start people at 0.5 milligrams per kilogram, which is pretty industry standard in a safe environment. Some clinics will start people at 1 milligram per kilogram. And that can be very, very intense for people. It's not a good place to start. And so it's important to be aware of that. So to answer your question, like I think most people could benefit from getting out of their own way. That being said, it's really important to me as kind of a purveyor of this as a torch carrier when we don't learn from history, we're doomed to repeat it. And so when we look back at the 1960s, 1970s, there was a huge body of evidence coming out about how effective all the ego dissolution agents were for just like curative for trauma, curative for alcoholism, curative for depression, curative for anxiety, curative for panic disorder. And in my opinion, at least part of what happened historically was that some of the researchers, some of the clinicians started getting high on their own supply and then started touting it as this panacea, as this cure-all, and they were working with other substances, obviously, largely LSD, acid, psilocybin, those types of things. And those are still around, and those are now in late stage studies showing incredibly efficacy. So super interesting time to be in medicine, really cool because we're actually proving past wisdom with science. And so, that being said, they were touting, screaming from the rooftop, how effective these things were, joking about slipping it into politicians, like giving it to them unethically, slipping into water supply. Obviously, that's not a good thing to joke about because so many people aren't ready, right? They aren't safe. So letting those walls down isn't a good idea. And so like that Maslow's hierarchy of needs, right? In the bottoms is safety and security. On the top is that self-actualization. I like to flip that pyramid. I think the next step is real true love for yourself. Kind of all the shoulda, woulda, coulda, didn't does. And only after that, I'd argue, could you love other people, the other people in your life? And then after that, kind of love everyone and everything. That being said, I love that Ram Dass quote. It's like just when you think you're in a good headspace, go spend a weekend with your family, right? And so David's awesome. Like I loved meeting David and working with David. He came in and I was doing a presentation, psychedelic psychiatry, trauma resolution through ego dissolution. And so we talked about kind of all the ego dissolution agents in that presentation. And again, they're all kind of late stage studies. MDMA, ecstasy, I'd argue that that's probably the best well-tolerated ego dissolution agent for a large swath of the population in psychiatry. That's why I got into the insurance field because it looked like it was going to be coming available middle of last year. Unfortunately, and this kind of speaks to some of the pitfalls of some of those longer acting ego dissolution agents. So like, ketamine 45 minutes and you're pretty much back on planet Earth because there are definitely psychedelic properties to ketamine. Um, in the psychiatry world, it's kind of looked at as a side effect. And really what we're looking at is the neuroplasticity is what we want to work with and what we want to capitalize on. That being said, like MDMA, it's 10, 12 hours for a lot of people. Ketamine, again, especially IV ketamine, I'd argue most people should go there first. It's a dissociative anesthetic, so it's a little bit different. People will parcel through like big, heavy war trauma, childhood violence trauma, rape trauma, not as like viciously or viscerally living in that trauma, but as like shapes and colors and kind of metaphors and just kind of like a different experience. I don't know if you saw that Inside Out movie, that child movie where they're walking through the hippocampus and then they change from this normal characters to like shapes and colors and kind of just like so that's kind of how people process trauma in the ketamine a lot of the times. It's not necessarily like kind of living that, it's like feeling it. And so in general, pretty much everyone who's traumatized, and I can go into my trauma spiel if you want to. Like I say, I kind of say it a lot, so this is like but I think it's super important and it gives people weight to it. So the people that can benefit from ketamine, again, it's off-label usage. Most people who feel like they're stuck could potentially benefit from ketamine. Particularly those who've been way stuck. Like it's not great for business, but I tell people no one needs ketamine. No one needs an ego dissolution agent. There's a million other ways to get to a healthier headspace. And in general, they're all considered non-specific amplifiers of the human experience. That being said, without some sort of catalyst, and that's what I would view ketamine as a catalyst, not a cure. No silver bullet, a million silver BBs, and that's how it should be looked at. That being said, without a catalyst, some people take decades to get there, if ever. And that's really what we like to use the treatments as. And then people that, maybe aren't good candidates are people with uncontrolled hypertension. So their blood pressure is just unsafe. Like last thing we want is to someone have a stroke, or a heart attack while we're working with them. So we can mitigate some of that. That being said, if your pressure is running really high, we want you to get that under control a little bit. Because it's just all plumbing, like again, I worked in the cardiovascular intensive care unit. And so your pipes, are your arteries and veins. And you put those arteries under too much pressure, you can get an aneurysm and those aren't good. You can get a ruptured aneurysm, really not good. And so really we want people to, and it is very dose dependent on the ketamine. So again, ketamine's on the World Health Organization's list of essential medications as an anesthetic because it's the only anesthetic that doesn't decrease respiratory drive by itself. And it's the only anesthetic that actually supports the cardiovascular function. So we actually see people's blood pressure raised by 20 to 30 points systolically during most treatments. And so, we can mitigate most of that, which is like oral antihypertensives before, and we can give IV antihypertensives during, like labetalol and clonidine. Clonidine's oral, labetalol is IV. And so kind of being aware of that. So hypertension is a big deal. Kidney issues, like real bad kidney issues. So like there is one thing that ketamine we know does at like very high dosing, like all the time. So ketamine is a drug of abuse. Like I want to be super clear about that. I don't think that anything's inherently evil or good. The dose makes the medicine and the dose makes the poison. And so that's why I really like to, say like, hey, we're doing this on purpose. We're doing it in clinic primarily, and we really want to do a heavy vetting as far as like I've turned people away. Or like, I just want to try ketamine. I just want to get high. I'm like, that's not why we're here. Like, so we want and help people set an intention. Like, even if your intention is to get unstuck, even if your intention is to like live your best life, like we're able to do this, off label, and we want to be safe and make sure everyone's on board. But it's kind of nice not having to navigate the insurance landscape when it comes to that because we have kind of a wide variance we can use. Because who's to say, who's to be the gatekeeper, right? If you're coming in and you're like, hey, I recognize like my life isn't quite where I'd like it to be, I'm kind of this low level depression or anxiety. And then, you start talking to people more and there's some just suppressed or repressed trauma that they haven't really had a safe place to deal with. I like to think of like the rats. So you get a male and a female rat. You're like, oh, you guys bother me. And you just throw them in a closet and shut the door. And then you just close the door and don't think about it. Oh, what are they going to do? They're going to procreate, right? And so when they come out, it's like 10,000 rats. And you're like, why is this so intense? And it's so intense because you haven't dealt with it. And so again, your psyche always wants to move forward. The journey to wellness is just that. It's a journey. Um, so hypertension, kidney issues, pregnant, like we don't know that ketamine is teratogenic, like it would kill a fetus. That being said, we don't know it wouldn't. And so there's just not enough data. That being said, like I've treated women that might have been pregnant because it's 95% effective for suicidality. And people tell me, hey, like if you don't treat me, like they're not like a threat, but they're like, like I'm here on purpose. Like I'm 99% sure I want to kill myself. Like I have a plan, I have an intent, I know where I want to go, I know how I want to do it, and I'm not going to the inpatient unit. I refuse to do that. And I know what this can do for me. Like I don't like ultimatums like that. It doesn't feel good. But like in the same kind of vein. And I'll have that frank discussion. Like, I don't know. You've had unprotected sex, you may be pregnant. And there's a real high likelihood of you killing yourself, which has a really high percentage of damaging the baby and the client. And then the ketamine has a we don't know percentage. So I've treated clients, with those types of, so it's always like a benefit cost, I've treated people with hypertension too. Just when they're like, hey, like I'm at the end of my rope here. Like, my chronic hypertension is something, if I stroke out on the table, like I'm signing all your paperwork anyways to say I'm not going to sue you. Like, I don't want any of that to happen. And I'm always going to treat in good faith if they're like, I don't know, I kind of heard about this. And then we check and they've got like an undiagnosed heart murmur, which is another contraindication, or their blood pressure's through the roof. I'm like, maybe let's go get that checked out. And they're like, oh yeah, cool. So we've done that a few times where people go out and they get all their stuff kind of looked at and checked out, and then they come back to us and then they get treatment. And so again, I always think benefit costs when we have something that works this well, that is this well tolerated, that's 95% effective for suicidality or up to 95%, then like I'm gonna go there. Like, like I'm gonna have that discussion and I'm gonna be frank with people. And like again, I've worked in traditional medication or traditional Western medicine for over 20 years. And it's kind of soul crushing work. What I get to do now is so rewarding. Like I get the chills pretty much every day I work. It's a really fun job because I'm helping people help themselves. Like I'm not the healer. I'm turning the key and getting out of the way, helping people remember how capable they've always been.
I really love everything you're talking about. I've got some just basic questions. Is it legal in all 50 states?
Yes. Yeah, it's an anesthetic. And so anything we're using it for besides anesthesia is considered an off-label usage. That being said, there's a derivative, esketamine, Spravato, which is a nasal spray. So what Janssen and Janssen did, big medication prescriber, and I thank them for this. Like I'm a yes and guy, right? And so what they did was they isolated the S and the R enantiomers of the ketamine molecule. And because of that, they were able to patent the S-ketamine molecule, which technically has a little slightly less dissociation when given by itself. And they were able to charge, $5,000 a dose for it. That being said, they spent hundreds of millions of dollars to get those two treatment indications. So it does have an FDA treatment indication for treatment-resistant depression. People have tried and failed to pass antidepressants or acute suicidality. So people are coming in like, I'm going to kill myself. And they do Spravato, and I'd say Spravato is about a fifth to a third as effective as IV ketamine. So a world away from most antidepressants. That being said, it doesn't seem effective enough that people get off of it. People kind of just stay on it. So you do twice a week for 4 weeks, and then you do once a week kind of forever. And that's more of what I see with Spravato. And so again, I'm the most passionate about IV ketamine. And you look at, I mean, that's a bigger, I don't know if we're going to go there, but I did an infographic, and it's like the cost for a patient to go through an induction series of Spravato is around $10,500 for those 4 weeks. And that's kind of that costs all of our, anyone who's paying into an insurance system. And then IV ketamine is like $3,000, and it's more effective, And so it's just interesting. And we make more off of IV ketamine. So, it's just it's like who's, I don't know. It's a bigger conversation, like I said.
So is it covered by insurance? How does that work?
S-ketamine is, Spravato is, IV ketamine is not. And so intravenous ketamine, the Veterans Affairs Department has an IV ketamine protocol built in. We've actually applied to get one of their special contracts so that we can give it at all three of our clinics, but they're not writing any new contracts right now at the Veterans Affairs because they want to bring that service in-house. But they've been talking about that for over a year. And, I want to provide that relief to veterans. There's another, and anyone who's served, like, but particularly veterans. Like my father served; he was in the Marines, and he died at age 50 because of PTSD, kind of sequela. And my uncle, who also served two tours of duty in Vietnam, he went crazy because of it, and it sucks. Like there's, they're not an outlier. Like war is terrible, and the fact that we glamorize that and send our young people to that and then don't give them the care that they deserve and need when coming back, it's heartbreaking. And so we're really passionate about increasing access to something that's different, right? And so we're getting credentialed through all the insurance as so that we can provide whatever we can provide through insurance. Again, IV ketamine is not like no insurance seems to want to cover IV ketamine right now. I think there were a couple of outliers because they just looked at the evidence, and the evidence speaks for itself. Like you look at peer-reviewed articles, and they mirror what I said, like 70 to 95% effective. Where again, traditional antidepressants, where every insurance steers people to 10 to 30% effective long term, and just making people live like less everything, which stinks. Like I'm not a big fan of that.
So is this with the insurance, is this just for the state of Arizona or is this for the entire country? What you're
For
talking
the
about?
Spravato, the S-ketamine,
Yeah, and for no insurance for the IV.
yeah, pretty much across the board, like no one's covering the IV ketamine. The VA, if your VA, your local VA has the IV ketamine in-house or a special contract, like there is a special contract of a clinic in the Valley that will cover IV ketamine for veterans, which is awesome. I love that. Like, and as I said, we were applying for that, but no commercial insurance. I think Anthem, Delaware, I think that one is one. And only in the state of Delaware, or they have some. It's very infrequent, and I hope to expand that. Just because again, the evidence speaks for itself. Incredibly safe, and so there are some. And I'm having a conversation actually tomorrow at 8 a.m. with a representative from a company called Enthea, Enthea, and it's a company that contracts with large employers as a separate insurance. So like, at large employers, they'll have like a dental plan and a vision plan and a health plan. So there's a separate plan for IV ketamine. And so basically like a mental health benefit when people are struggling, and it does. Like that's the biggest thing. Like I'd say is like we're not changing your situation, we're not changing your background. We're helping you shift your perspective enough that things just kind of less bothersome. And that's what I see is like, everything just gets a little bit easier.
So talk to us about the integration because I understand that not all clinics are provide that, and which is was a little bit shocking to me that it's not
Right.
just a natural part of this as you're going through this amazing big process, inner process, to not automatically provide or have available the integration.
Yeah, absolutely. I think integration is paramount again. And so there's three basic tenets of our treatment. Is one is name it to tame it. And so kind of understand where it's coming from. And again, that's that kind of elongated trauma spiel. Two is feel it to heal it. And that's where ketamine does a really good job. Seen people with ayahuasca or psilocybin get kind of stuck in the suck for months. With ketamine, longest I've seen is a couple days. And so again, I think it has to do with like a dissociative anesthetic. Like instead of actually living through, your war, or rape trauma, or whatever it is, early and often physical, sexual, emotional abuse or neglect. We know neglect is far worse than abuse for most people because your needs are just never met. I mean, they all stink, but the big capital bold T's of trauma, little italic T's of trauma. And so with that zoomed out, instead of kind of visualizing, exactly what happened, you get this kind of like you're from outer space looking down. It's just kind of a ball of intensity. And then you're able to process through it like that. And so name it to tame it, feel it to heal it. And the feel it to heal it is, I think, really, important and it happens quickly. Sometimes it does during the ketamine treatment, much more though in the integration, especially when you set aside the time for it. And then the biggest shift, we're kind of trying to help people help guide themselves to. Again, I really want to talk about its empowerment. Like I'm not the healer, just turn the geek out of the way. And so with that, we want to make that shift from this happened to me to this happened for me. And that's a big shift, for a lot of people. And finding the gift in it. And so like our integration workbook, like I said, we go through that kind of cover to cover first time we meet with people. I think it's so important. Um, and that being said, like when people first come in, they're kind of in that they've been in this kind of stuck state for a long time, and that's so exhausting to live in. And so then with that, what I like try to help people too is to like empower them to remember because like so much of Western medicine, as you know, has been very much that patriarchal model. It's like take this pill and call me in the morning. It's like this will get you better. I will get you better. I am the gatekeeper. And so we see that all the time, right? Like in my psychiatry office, I know I'm normally I'm in like a suit and tie. I'm like whatever. I was cleaning up my yard. We did this quick. And so really it's about, yeah, I know you look awesome. I love it. Spread love. It's beautiful. Is really being able to just create that setting, like that set, like you need a foundation to build off of, right? And so like first just being able to understand that, there is room and that validation of yourself is so powerful. And so again, some people have these really profound experiences. Like, I think David said we could talk about his. And so like, where people get in trouble is the judgment, right? Like the actual emotion is always good because it's teaching you something. It's a message from the universe, right? Like, hey, this sucks. And so, David went into his experience and he was so afraid of Demon Dave. Like Demon Dave was this like intensity of this, like this ball of energy that was causing all these problems and making all this trouble in his life and keeping him from sleeping and like, keeping him in this kind of hyper vigilant state, like this, time marching on all those things. Very interesting case. And like, I love David. He's awesome, dude. He's such a cool cat. And then like when he had his experience, he recognized that, the demon Dave was just this scared little boy. And then from scared little boy, like you back a dog into a corner, right? What it's going to do, it's going to react, right? And so trying to protect itself, that's all the ego does. And so really trying to recognize that and validate that, so important. And that's part of the integration, right? Like that, no such thing as good and bad emotion, only bad emotional reactions, right? And so we have this whole, again, integration workbook. We go through the accept acronym cycle, which is acknowledging that emotion, calmly breathing into it, being curious with it, expressing that emotion, processing that emotion and then trying to find the gift of that emotion. And I have people do that for every fifth of their life with a forgiveness cycle for every fifth of their life. And that is like so powerful of an exercise for so many people. And again, it puts them back in the driver's seat because just like a psychiatric provider, regular medical provider, therapists also are not very incentivized to get people better, right? Like you fill up your caseload, you see this person weekly forever. I'm like, oh, that doesn't feel good. Right? Like, I don't want to be your friend. I want to get you out there so you can make friends. Like, you're paying me, right? And so, like, I try to be clear with that. So we do group integration, which is a super fun experience because we only open that group integration to people who've done a ketamine experience, especially a ketamine experience with us, right? Not just a regular kind of, recreational ketamine. Because again, dose makes the medicine, dose makes the poison, and that set and setting are so important, man. And so like, people may get some insights. And there's no physiological dependency like there are with opioids or benzodiazepines or even nicotine or sugar. But people can get addicted to the feeling of ketamine, kind of checking out, right? That was the whole Matthew Perry thing, right? He had like 47 shots of ketamine from his assistant and went swimming alone. We don't recommend that. And so, not to make light of the situation, like I feel for him and his family. Like I read his book like a year before he died and he was suffering for a long time. He was, substance abuse, hypersexual. He had been drinking like handles of vodka on the Friends set multiple times. And so I think it's just important to recognize you can do too much yoga, right? You can drink too much water. You can drink too little water. And as much as possible, like trying to keep it sacred, right? I think that's so important. And so like I tell people, you could probably be more healthy, and I really believe this, like eating chocolate cake all day, if you're eating it very mindfully, than shoveling in fruits and vegetables. Like if you aren't like eating with intention and eating with mindfulness, you're not going to get the same amount of quality calories. You're not going to be able to really enjoy your food because like the only moment we really have right now is right now. Right? We can try to build towards a better tomorrow. Like we're recording this for release in a while, but like, why not make the most of right now, And then if you're eating chocolate cake all day, like eventually your body's going to be like, hey, like this isn't really what I want nutritiously. And then you'll be able to kind of make those kind of forward movements. So we have that group experience, and that takes place in person at each of our clinics once a week. So I'm running those groups with the help of a psychedelic integration coach most of the days. And so Tuesday, I'm down in Prescott Valley. Wednesday, I'm in Sedona. Thursday, I'm in Flagstaff, in-person groups every week. And
How
then
many people are in
on
that group?
it's variable. Sometimes it'll just be one client and both of us, and that's kind of a fun experience. And sometimes there'll be as many as like 5 to 6. We had one group that I think like 7 to 9 clients. As the service grows, I expect that, to grow because the value is definitely there. There's a lot of people going through like online ketamine therapy places like Mind Bloom and Joyous and some other ones right now. And so we're just rolling out a service that is similar to that, but it also has like in-person integration kind of built in. So I tell people within 24 to 48 hours, 24 is really the golden window. So like you see me today for an infusion, your upper mammalian brain really goes offline the day of a treatment. And so like to talk therapy, like that kind of integration, you should do that tomorrow, like the day after. Anytime the day after is really solid. But anytime within 7 days is pretty good. Somatic therapy, like body therapy, like acupuncture, acupressure, cranial sacral work, massage, somatic experiencing therapy, those can be really good the day of a treatment. So like going straight from our clinic to there, as long as you know that clinician, again, it's got to be safe. Like, so you have an established like relationship with an acupuncturist or whomever, you go straight from us to them. Like the feedback that I've gotten from those somatic therapists, they're like, wow. Like this, I've been seeing this client for years, and they responded so much differently and so much better than they have ever before because they're just so open. Again, ego dissolution, right? We're letting those walls down, those walls that we built to protect ourselves. And some of those walls are depression, anxiety, substance use disorder. Some of those are going poop and eating food. So we want to keep some of those walls up, right? You can't live in that space, nor should you. Like it's interesting. Like I've seen enough of these journeys that it's been like so cool where you see, like my buddy said it, where you see overlap is where you see the truth, right? And so like everyone's got a lot right and a lot wrong, I think, and like organized religion to everything else in between. And it's so cool to see people remember. Like I had this client say it once, it really resonated with me. We're born remembering, we forget along the way, and our job is to remember again. And oh my gosh, that hit so hard. So for integration, people should do their own work, really like what feels right for them. Did you know that depression and anxiety went way up after rubber-soled shoes came out? So basically, we lost our connection with the earth. So I tell people, like, go outside today, like, take your shoes and socks off, put your feet in the soil, do some artwork, do some dancing. That type of work is integration as well. I tell people to do at least 40 minutes a week, 3 times a week, or 40 minutes 3 times a week to artistic practices. And so like, it could be something tangible like music or song or I mean watercolor or painting or something kind of just out into the ether, just energetically like dance or song. And it can be a better catharsis and a better kind of completion of the cycle and energetic expression of what you experienced than like talk therapy will ever be. And so that's another form of integration. And it's super important to devote that time. And that's where we see like next level breakthroughs for people. People like with this, really gnarly childhood, they pin their ACEs score, their adverse childhood experiences score. And then they draw this like dark castle artwork and then like either sell it or burn it or, just have it like tangibly out there. And it just represents, like decades of really challenge, like really a lot of challenge to them. And so that's another form of integration. So individual, I think everyone should devote time to individual talk therapy integration with someone who knows kind of what they're like able to hold space for people. And then the group I think is super valuable. And then the artwork I'm a big fan of. And then just outside time too.
So share with us what you can of some of the results that you've seen in your practice.
Oh man,
What
like yeah, go
go ahead.
ahead.
No, go ahead.
I got all excited. Like people's suicidality just stops. Like they come in and they've been thinking about killing themselves or actively attempting for years, or just basically fantasizing about being dead. And then they come in and they do one treatment with us, and that goes away. Like I'm like, what is this? If you don't do that series, it seems like it comes back a lot quicker. I'll just go into it just because I think it's important with where we're going conversationally. Again, everything comes from trauma. Trauma is super subjective. One person see their best friend ever blown up next to them on the battlefield, not be terribly affected. Genetic factors, resiliency. Someone else be called a name once on the schoolyard, it can haunt them forever. So very like intelligence and empathy is a deadly combination. People hold on to stuff. They're emotional sponges. Like evolutionarily, all this stuff happened too quickly. We should be going to sleep with the sun, waking up with the sun, living off the land with like 13 families where everyone's a cog in the wheel, and that your role is super well appreciated and needed for your tribe to thrive. And so empathic, intelligent people, those are the healers. Those are the people that can hold on to that space for people. And so they break bread afterwards. They kind of live with them. And in this current evolutionary state, we're able to hold the empathic load of up to 120 people, no more than that. So you turn on your phone right now, you turn on the news right now, you're subjected to way more than that. And so people hold on to this. So there's four main types of trauma with those big capital bold T's, little italic T's of each. First one's your own historical trauma. That's every catecholamine or stress or exposure that you've had since your parents' two zygotes first met, the egg and the sperm. So all the stress your mom had during pregnancy, your actual childbirth, everything before you started forming concrete memories, and everything to where you're at now. That's just the first type of trauma. Second type of trauma is intergenerational or epigenetics. We're just scratching the surface on the science of all this super interesting stuff. We know at least 5 generations behind us, the trauma that our great 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 grandparents went through prior to procreating mutated their genetic expression at least enough to pass on increased hypervigilance to us, which is good. We live in a township surrounded by saber-toothed tigers, right? But not necessarily if you're in a safe environment. Third type of trauma, and this is what pushes people back through our doors more than anything, is that societal trauma. So in general, it just kind of sucks out there. People have their walls up and they're trying to protect themselves, right? And so in general, living in a patriarchal capitalistic society with an economy of scale and a largely disconnected family unit is pretty bad for our brains. We're still trying to play catch up to all that. Fourth type of trauma is environmental, and showing that microplastics, cell phone radiation, forever chemicals, BPAs. Like receipt paper has like more BPA than any water bottle you ever had. It's bonkers. I just found out about that. So, but all that being said, and all that being said, all those big capital bold T's, all those little italic T's, they're all healable. They're all integratable, given the right setting, and circumstances. So you think of the gazelle that gets caught by the lion, right? It goes into this, uh-oh, I'm done for, kind of fight, flight, or freeze state. Then the lion realizes, oh, I got my prey, starts stalking around being a lion. Gazelle realizes it doesn't open and it pops up and it runs and it runs and it runs. And then 3 to 5 miles down the road, it's got this physiological shudder, this like cellular level release that's still built into our DNA as mammals. And that's what I'm seeing. Like that's the treatment outcome. Like that's what I see in my ketamine treatments is that safety, like feeling safe to feel safe. Then the work can start. And it is work. It's healing work, right? It's a healing journey. It's not not a healing destination. Maybe reach plateaus along the way. Hopefully we're all trying to be slightly better humans than we were yesterday. And sometimes it sucks. Right? Got to enjoy the ride.
Well, that's really wild to hear all of this. Now, just what came to me, one of the things while you were talking is, so if while I was in utero, my mother suffers some sort of trauma, how am I going to be able to get in touch with that if I'm completely unaware of her story or anything like that?
So yeah, your cells are aware. There's a Bessel van der Kolk's work, The Body Keeps the Score. So we hold that as like neuro-emotional complexes, these inflammatory corticoid clusters that are tied into our body, tied into our expression of our, ribosomes and all these kind of genetic markers. Well, it's more of a proteome than genome. And that's like kind of the next wave of like individualized kind of medicine is the proteome, and it's super interesting stuff. But basically, your body's aware, and you live in this hypervigilant state. I just had this super interesting client that was born like 5 months premature, survived, right? But spent like the first year and a half of life in the neonatal intensive care unit. And so to this, like before he started treatments with us, every little ping, everything that sounded like a alarm sound in the hospital immediately shot him into a hypervigilant state. Was he forming concrete memories at that point? No. Was his body aware of unsafety and how much that sucked? Yeah. And did he hold on to it? Yeah. And was it healable? Yeah. And it's super interesting because that's part of my concern again about the longer acting ego dissolution agents as they become available. There's so much transference and countertransference, like you reminding me of someone from my past and me reminding you of someone from your past, and the way that we behave accordingly. And then when you're on ego dissolution agent state, you're super plugged in. So there's a lot of role shifting, like where you become the clinician and I become the client, and then that it raises some muddy waters. And then like we all bring our own trauma into every interaction. It's just how we carry ourselves, right? And so like, and then ultimately it's a job for me. I love what I'm doing, but some days I'm gonna come to work like 40% of the clinician that I could potentially be. And so like if I'm trying to talk to you the whole time, like you're having an experience, like you're gonna pick up on that and it's gonna suck for you. And so what we do is what I call the intrinsic response methodology. And the whole premise of that is you'll always be your own best healer. And subconsciously, you know where you need to go. And so just me having that kind of upfront conversation about the trauma and kind of validating it enough that you know kind of what it's about, then your cells can kind of go there. And without that, I think they would too, because like you said, some ketamine clinics, they get amazing treatment outcomes and they don't do any integration. And so, they let people play on their phones. We do eye shades, noise canceling headphones, and really help people set an intention. We go through flight instructions, we make sure the environment's super safe. And then we do some debriefing with people afterwards as far as like how their treatment went for them, any big themes come up for them. And then we can use those footnotes if they're seeing our therapist, the next day, or we can forward them off to their community therapist so they can use those notes. And it's super valuable stuff because a lot of that stuff slips away pretty quick. Um, did I answer the question?
Yeah, absolutely. And it
Okay.
just takes me into this whole other realm. One of the things David said to me was, I believe that a vast majority of humankind could benefit from ketamine therapy, and he cannot recommend it more highly. And so I'm sitting here and I'm like, I've heard a lot about it. Um, I'm in my own world. I'm a healing practitioner. My whole life is dedicated to that, from different modalities, including talk therapy and everything. Nothing I've been traditionally trained in, just what my soul and spirit has been guided to. And I'm listening to this and I'm like, and I keep thinking, oh, ketamine therapy might be kind of a cool thing to go and experience, but it's more like because it's going to help me with that. That's never the next step in my thought process with it. And now that I'm speaking with you, I'm like, I wonder what it would bring up for me. And yet I don't have anything as I'm sitting here. I'm happy. I sleep well. I have a good relationship with my wife. I love what I'm doing. I'm in my path and my mission, and so it's everything's very fulfilling in my life. But I gotta feel if I did some of this therapy that, like what was going on with my parents when I was conceived and this and that. There's gotta be stuff there. And then I'm starting to realize, wow, this is really for everybody except for the people that you said it's not with the hypertension illness. And so for someone like me, that there's no pressing issue, there's no pressing symptom, then I would be like, wow, this could really be my answer. What would you say to that? Like specifically for me?
So yeah, like a lot of times people come to us kind of with that like mentality. They're like, I don't even know where I'd go, or if this is something for me. And honestly, it may not be. Like I don't know you well enough to say, hey, I know that this might be something for you. So we like to start with a 30-minute consultation. We kind of go through, we have like a standardized consultation sheet. And then that gives us a bunch of information to kind of cue off of to say, hey, like what would you be kind of working towards or not, and then sometimes just in that 30-minute conversation, because the wounded healer is a thing, right? So like things will come up that you like have suppressed or things that you didn't remember that may have been nagging you. And, there's chronic pain and inflammation kind of benefits from ketamines. Chronic, it's an anti-inflammatory pretty profoundly. And so a lot of people will come in with like more physical complaints than, mental health complaints. And it can help with that too. Again, just get that physiological shudder. Then your cells get a chance to breathe, and then your innate healing wisdom comes back online. And a lot of people are able to kind of let go of a lot of chronic conditions, autoimmune disorders and chronic inflammatory conditions. And those get better like over time. That's like a 2 to 6 months down the road kind of thing. And so again, very individualized. Like I'm not going to say like, you come to me, I'm gonna treat you. I'm saying let's start with the consultation, 30 minutes. Let's talk about you and your unique situation. I think that should always be the case. Again, I want to keep that sacredness in, right? You could go to a big party tonight and you get ketamine, right? I know you probably could, and most people could. And like, I don't like that. Like, I think like you should be existing in a healthy enough place that you can use these medicines as sacredly. And some people, that sacredness is psycho-spiritual expansion. Michael Pollan's book, How to Change Your Mind. People that don't even necessarily know that they're stuck, but they're kind of plateaued. Like it breaks through that glass ceiling, and people are able to give more. I like to use that kind of analogy of like trying to fill up your cup from below. Like I'm doing all physical activity. I've got my social connections, like doing all these things. Like, and it's like I almost got it. Like, well, probably not. And so let's really write that cup, and then let's take that time and energy to fill it. And so a lot of people are human doings at this point, not human beings. And so that's why we have Rocked too. I don't know if David talked to you about Rocked, but Rocked is designed to be a precursor to or an extension of Revitalize Ketamine Clinic. So it's an acronym: Revitalize, Optimize, and Harmonize Clinic and Therapeutics. So revitalizing is where most people start at Revitalize Ketamine Clinic, like recognizing that they're stuck in some ways and recognizing they could feel better. Optimizing is kind of that daily practice, like that physical activity, that meditation, kind of doing those healthy things for yourself on a daily basis. The harmonizing is kind of living in your Japanese ikigai, that Venn diagram overlap. Let me close the door. Uh, and so the ikigai is that Japanese kind of Venn diagram overlap of what you're good at, what you're passionate about, what the world needs, and what you get paid for. And so trying to help people go more towards that with how they're investing their time and energy. Seems like you're doing that, and I love that. I know I'm doing that, and I love that too. But a lot of people aren't feeling like they're there. And so, we're not a strengths-based educational system. We're not a strengths-based society. We're trying to create all these good employees, through our educational system. And in my opinion, that's not the move. We should do aptitude testing early in life and help people really find their passion, find their ikigai, and be able to exist in that. We'd have a lot cooler of a society, if you ask me.
I love this. Thank you for addressing that. That was personal to me, and I got out of it what I needed. Now we're nearing the end of our discussion here. Is there anything that we've that I didn't ask that I should have asked? Anything that's been left out? Anything you want to throw in here toward the end?
Um, I just think, really being mindful of how we're going about this. A lot of people aren't going to see me that are listening to your podcast, and that's totally fine. But do a heavy vetting, like decide if it's for you, first of all, and decide if, who you're going to potentially work with is for you. I'd really strongly advise to stay away from like the nationwide ones. Just like if you look at Mind Bloom's website, they say, we don't have any medical practitioners. We contract those out. And so all of the like kind of liability falls on the practitioner while they're pretty much pushing the prescriptive practice of that practitioner. So it's just kind of muddy and I don't like it. So if you lower cost is what you need, I would still go to a local ketamine clinic. We have like a oral system that we can do. Again, it's not going to be as effective as IV ketamine, but I'd much rather have people go to a local place than a nationwide place. And then it's much more cost effective. Like our infusions for a package pricing of 6 infusions is close to $3,000. And then our oral dosing with 8 sessions is like $600. And so, like those prices may change as people kind of learn more, but like Mind Bloom's like $1,200. And then like, again, the Spravato esketamine, while that may be covered by your insurance, it's close to like $10,000-$12,000 as far as like the cost that you're having to kind of incur into the insurance system. And like ultimately, like what I want to leave people with is that no one needs ketamine, no one needs an ego dissolution agent. And what's good for you is good for the universe. So if you do feel like you're stuck and you do feel like there's room for improvement in your life, like we love to serve, we love to help you live your best life. And I think everyone else would too. The ASKP, it's the American Society of Ketamine Providers. I think most of the people in that pool are pretty good. And so you can get on a website and look up, and pretty much every major metropolitan area has a clinic or two, like within driving distance of it.
Excellent. We will include that link that you just spoke of. We'll include information on how to get to you with the information on the podcast. I want to thank you very much for really spur of the moment. We just connected earlier
Totally.
today, and we both finished up what we were doing and showed up for this. And it means a lot. Your energy's fabulous. Firsthand story from my brother. If I was ever going to do this and there's more thought now about doing it, I would certainly have you at the top of the list. And again, thank you for your service to your community, ultimately to humanity, and specifically to my brother. So
How about
thank you very
you?
much, and thank you for being part of the It's All Good show.
Absolutely. I love it. Thank you so much for having me. Make it a great day.